I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of Holistic Integration, where lives are changed every day through the natural approach to healthcare. Where we're going to talk today about the natural relief for kidney stones. So, Dr. Prather, let's talk about what are kidney stones.
Well, kidney stones are little stones that form in your kidneys.
Really?
Basically, what it is, you get too much particulate matter in there, and it forms a little crystal. And that does because you either have too much of the material or not enough fluid in there, or not enough things to regulate it, because your pH, in other words, the body has a lot of ways to keep all those things in suspension. And when the body is out of homeostasis, which is balance, then those things go out of suspension, and then they start to form little crystals, and those crystals get bigger, 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 until they start to cause problems, which can really damage the kidneys. And as people always said, it is the most painful thing that you can have.
Kind of like natural childbirth?
Worse. I've had people who've done natural childbirth, and they said, oh, yeah, I'll take that any day over a kidney stone.
Wow. Okay. So are there different kinds of kidney stones?
Yes. And actually understanding what kind of kidney stone is critical for treatment. Now, the majority of them are actually treated the same way, but there are some others. And understanding which one that you're dealing with can change exactly how you treat it. So there are, the most common ones are calcium oxalate crystals, and also calcium oxalate, calcium phosphate crystals. And they account between 60 and 70% of all the kidney stones out there in America right now. They are a pH acidic forming. So getting to acidic is one of the major problems that actually creates that. And for people who pass them, they say that they see little black or brown, like little seeds, hemp seeds, or like mulberry type seeds is the big thing that you see along those lines. Then the next most common is a calcium phosphate, and they're about 6 to 8% of the kidney stones out there, and they're called staghorn. They kind of form little horns that stick out, which doesn't feel good. Those are the ones that really hurt as they pass through, as you can well imagine.
Thank goodness they're only 6 to 8% of the kidney stones.
And each of these are easily found on x-rays and other imaging because they're opaque. You have a magnesium ammonium phosphate crystals, which can account between 15 to 20%, usually kicked off by infections in chronic infections in the urinary tract system. And they're also staghorn, so those also hurt, but are treated completely different. Then you have uric acid crystals, which are translucent. It doesn't show up oftentimes in different types of imaging. You have to do a CT scan for that. And 6 to 10%, and dehydration plays a big role along those lines. Also, gout plays a very big role. And then you have cysteine, which is the rarest. They're about 2 to 3%, and it's a hereditary type of a kidney stone.
Who would have known there's different kidney stones? I thought kidney stones were kidney stones. But it is important to identify what kind of kidney stone that you're actually dealing with, because as we find them, we do treat them differently. And sometimes some of the treatments can actually irritate one of the different types. So you can't just assume. Right.
You need to know. And we always know what kind of kidney stone we're dealing with. Yeah. There are tests for that.
So what causes kidney stones?
Well, kidney stones, it's a Western diet. You do not, if you have a natural diet, it's actually kind of rare. It's been identified for thousands of years about kidney stones, but the increase has been rather exponential lately. Low fiber diet. You know, I sit there and say fiber, fiber, fiber. You know, if we have one thing that we can go on ahead and help people with, it's a high fiber diet. And low fiber diet seems to be one of the main things. Refined carbohydrates, sugar, white bread, all those types of things. Matter of fact, they had people who had chronic kidney stones. They switched them from white bread to whole grain bread, and there was a 50% reduction in the number of kidney stones that people have.
That's big.
It's very big, kind of fibers. High alcohol, drinking a lot of alcohol. High animal protein diet. Vegetarians have a much lower rate of kidney stones. And again, one of the things in high animal protein diet, it's basically that you're low on your fiber. High fat, soft drinks are especially bad, especially with high fructose corn syrup is like kidney forming material.
Kidney stone forming material?
Yeah, you should just put on there, we form kidney stones. So if you have ever had a kidney stone, you should always avoid high fructose corn syrup. It is really, really bad for you.
I don't think they're going to market it that way.
Yeah, they don't market it that way. Okay. Acid-forming diet, dehydration. One of the things that they say is the Southeastern United States is called the kidney stone belt.
Oh, so the Southeastern.
Southeastern, yes. And that's because you sweat a lot and you get dehydrated.
Talking about Florida.
Yeah, Florida, Georgia, Alabama, Mississippi, Louisiana, Gulf Coast on Texas. That whole area and through there is like kidney stone heaven. If you're a kidney stone specialist, that's the place to be. And also they drink a lot of sweet tea with high fructose corn syrup.
And they're getting dehydrated.
Obesity is a major factor, and that's a high area of obesity. Any kind of endocrine disorders, adrenals, thyroid, parathyroid, all those things play a role. Diabetes, oxalate foods, which there's quite a few of them. And then if you have something called a metabolic syndrome, that's where you have a larger waist. That's also where you have hypertension, high triglycerides, all those different types of things, and that metabolic syndrome can also lead to kidney stones.
What do they call that? Metabolic?
Yeah, it's called a metabolic syndrome or syndrome X. And it's people have a more of a genetic type of factor and then also dietary type factor. So best way to kind of work with that is a lot of aerobic exercise and then also a restricted diet plays a big role.
So what are the 4 stages of a kidney stone?
Well, first off is the formation in the kidneys themselves. And that has no symptoms. You actually don't know that that's happening. So that's kind of one that sneaks up on you. And then when it moves into the ureter, from the kidney down to the bladder.
That's that little tube.
That's when you know that something's going on. You don't feel very good. And interestingly, the pain actually starts in the groin. And then as it moves down, it actually moves up.
The pain does.
The pain does, which is a very interesting type of thing. It goes opposite. Pain is not always where the problem is. Also, as I do examinations, their kidneys are real sore. And just to let you know, we get a lot of kidney stone patients in our office. Because the first thing that they feel is some back pain.
Low back pain, yeah.
Yeah, it's like my back really hurts, and I've been to 3 chiropractors and physical therapists, and nothing's helping. And I go, ooh, That's not your back, that's your kidneys. Let's check to see whether it's an infection, a stone, and a lot of times it's actually kidney stones that are actually starting to give the problem. Then it goes into the bladder and they go, oh, relief. That's when people say, okay, I think it's over. And then it passes into the urethra. And it really hurts at that point.
So they get a little break and then...
Yeah, they get a break, and then if it starts to go into there, when it goes into the bladder, that's a good time to try to dissolve it. It's going down through there, but trying to get rid of it at that point is a real good thing to do.
So how common are kidney stones?
Well, right now, it's you have a chance of having a kidney... 12% of all Americans have a chance of having a kidney stone, which is really high, and it used to be pretty rare. So there are 500,000 visits to the ER for kidney stones every year. Men are more likely than women, and 50% of them have another kidney stone attack within 7 years.
Wow. Why men more than women? You have a theory on that?
Yes, men actually operate and eat more meat, and it's dietary. I believe a lot of it. Men have a tendency to eat worse than women do.
Okay.
In my opinion.
On your opinion. Well, on that note, we'll be right back with more information on natural relief for kidney stones. Holistic Integration is excited to announce the launch of our very own dietary and herbal supplement line, Stasis Supplements. Stasis Supplements are created to maximize our patients' experience of true health by bringing mind, body, and spirit back into alignment. Learn more about Stasis Supplements on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip featuring rapid release technology.
One of the chiropractic friends who is a soft tissue expert, his textbook, Soft Tissue Therapy, is the one used in medical schools, heavily used as sort of the Bible for soft tissue work. And as soon as he saw rapid release, he switched all of his treatments over to the rapid release because it's much easier on the doctor. You get quicker results, less painful, much better compliance. So when people would be coming in for the Grasson, they would be going, I like the results, but I don't know if I really want to do that. Whereas with rapid release, they come running in and really want that done because
they ask like, for it.
Yeah, they're like, okay, we got you cured, but can I have it again anyway?
Well, many patients have bought them.
It's an amazing device and incredible results. It's a great way to get your body relaxed and get those aches and pains out of your system.
As you're using the rapid release, you can see people go into that deep breathing and going more into that, what we call the parasympathetic mode or the rest and digest.
Really switches and has a huge effect on the nervous system.
And the sessions aren't long. You just do a few minutes in each area.
One of the patients recently with a massage therapist, as she was doing a massage on him, she's going, boy, I'm just having trouble really getting this released. Walked out, got the rapid release, and she did it, and the patient was like, oh my gosh, that's incredible. And she was saying, I got to use that more. To get those problem areas, it works so much quicker, so much easier. It just takes off all the stress of me trying to really work that out. And it's easier on the patient, too.
Relax muscles and release aches, pains, and tension through Rapid Release's high-speed vibration therapy. Experience the benefits of rapid release therapy by scheduling an appointment at Holistic Integration. And to purchase your own, go to our website at thevoiceofhealthradio.com. Click on the Rapid Release banner and enter code PRATHER, P-R-A-T-H-E-R, for a $100 discount for the Voice of Health Radio listeners. The market is flooded with various brands of CBD products, but all CBD products are not created equal. It's been shown that only about a quarter of the CBD products labels were within 10% of the actual CBD content within the container. In fact, many CBD products actually contain no CBD whatsoever when tested. Many CBD products, which are advertised as THC-free, actually contain illegal amounts of THC in the product, causing their customers major health concerns or even the loss of their jobs. Researchers have also found CBD products that contain toxic heavy metals and even cancer-causing cancer-causing pesticides. Jace Clinical Solutions is the most trusted CBD brand with a reputation of integrity and accountability. That's why it's carried in the natural pharmacy at Holistic Integration. Go to thevoiceofhealthradio.com, click on the banner for Jace Clinical Solutions, and enter the code Prather, Prather, to receive a 25% discount on CBD products you can trust. You're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, the most comprehensive wellness center in the Midwest. Well, we're talking about the natural relief for kidney stones. And it was interesting to me, Dr. Prather, you were talking about when people come in, they're thinking they have low back pain.
Sure.
Sometimes, and you find that there's kidney
issues.
Right. The people walking in your office, Holistic Integration, with low back pain, what percentage of those people is it kidney?
Wind up that kidney stones is an underlying problem? I would say about 20%.
Wow. Yeah.
Which makes sense. I mean, that's about the number of people that actually carry them. And then sometimes they don't actually go through the process or have never gone through the process of passing a kidney stone. Mm-hmm. But it's as we do the examination, we find, yes, you do have kidney stones, and it is something that we don't want you to pass, but it's also causing kidney damage. Mm-hmm. Right. That forms in there. Mm-hmm. Oftentimes we see protein in the urine because of that, meaning that there's damage to the tubules in the kidneys. So we start some treatment at that point to get that under control. And as we do that, then the back pain goes away.
So are kidney stones becoming more common?
Kidney stones are growing at a surprising rate, almost 1% per year. So it's something that as we become fatter, more diabetes, poorer diet, fast food diets are horrible for kidney stones. Mm-hmm. So yes, it's growing as we are not taking care of ourselves.
Right. So let's talk about treatment. How does the disease care model treat kidney stones?
Yeah, and the disease care model is what we consider, what most people call traditional, medicine. What they're very used to. And the first thing is they really don't treat it until there's actually a problem. Mm-hmm. And there's not a lot of prevention. So those are things that's why 50% have another attack. It's because they don't really go after that and help people to know exactly how to fix that. But for the pain, they use non-steroidal anti-inflammatories, which are effective. They do cause problems in themselves. They can cause some liver problems, kidney problems, that type of thing. So any type of long-term type of use. There are natural alternatives, as we had talked about before, that oftentimes even work better for the kidney pain.
Yeah, we talked about that extensively last week when we talked about the hip pain and mobility.
Right, and that's also something that they prescribe along those lines. And again, all pharmaceuticals cause problems, but that is something that does relieve the pain. Also, then they go into alpha blockers. And basically what they're trying to do is relax the muscles of the ureter. They give products with potassium citrate to help to dissolve the kidneys, and that's one thing that we'll talk about, which is actually pretty good. Kidney stones. Thiazide, which is a diuretic. You get more fluid into the kidneys, which helps it to pass. And then allopurinol, which reduces the uric acid and alkalizes the urine, which is actually a pretty good medicine along those lines. And when things become severe, the disease treatment is actually pretty good. It is actually excellent. And then they also go in there and use different types of modalities to break them up, which, if they get too big, is something that needs to be done.
They go in and blast them?
Blast them with shockwave therapy, lithotripsy, nephrolithotripsy, ultroscopy. Those are all different types of things that they can use for treatments. And sometimes that's very necessary and extremely helpful.
Mm-hmm. Well, let's talk about the role of structure-function care and what that plays in treating kidney stones. And structure-function care is what we practice at Holistic Integration.
Sure. And the big thing that we do is work quite a bit on prevention. So, one, if you show a tendency towards or starting to form kidney stones, then we have a whole program that works quite well, much easier on you than the pharmaceuticals to get that under control. So we work with diet, we work with supplementation, we do several different types of treatments on that are extremely effective. Also, if it's early stages or if you're having some pains associated with it, it's not enough to go to the ER, then we actually have a whole program for taking care of that too. That is extremely effective. I've had patients who came in. I had, I think of one gentleman who had like recurrent. He had about 2 kidney stone attacks a year, which is, I mean, I don't know how you make it through on that type of thing. And he got tired. I said, oh, you came in, and his wife had brought him in, and I said, that you need to go to the ER. And he sat there and said, I don't get that much relief anymore. So we started him on our program, and he said it actually did better. That particular gentleman did better under our treatment, and we're able to get things under control for it. So it is something that structure function. Again, we sit there and say 20% of all care should be disease care. And oftentimes, I mean, the stones are too large to pass, and you can't get them down quick enough, so you need to do the treatments. 80% of all care, and that goes with kidney stones too, should be structure function care. So if you have kidney stones and you're not doing structure function care to balance out the body, because kidney stones, as I said before, is completely a situation where the body is out of homeostasis. It's out of balance. The regulation of the body isn't working right. You get the regulation back through all the different types of means, then you don't have kidney stones anymore. So structure function care should always be a portion of the care of kidney stones.
Well, what role does diet play in kidney stones?
Well, diet is critical. Diet is the basic thing that causes issues. It's the modern Western diet causes this whole problem. So, you can't do fast foods, the colas, all those types of things, processed meats. When they sit there and, make the hot dogs and the bologna and all that type of thing, that goes through a process that actually kicks it off. So there's a whole, it depends also on what type of kidney stones you have, what diet you actually take. But diet is, if you're not doing a dietary change, you're not really treating kidney stones. So that's the big thing. And of course, fiber.
So why is alkaline urine so important in treating kidney stones?
Well, the majority, about 80 to 85% to 90% of all kidney stones is due to an acidic urine, which we create through our diet.
Right.
So getting ourselves alkalized is one of the most important things that you can possibly do for kidney stones. So, and alkalizing, now you don't want to, again, it's a homeostasis. You can be too alkaline and actually cause kidney stones.
Right, it's all balanced.
But that's rather rare. It's usually because of our diet, we head into the acidic state, and we weren't really made to do that. So controlling that and working on that right now, we're working on getting more alkalized.
Yes, you and I.
Yes, we are.
Yes.
And it helps in so many different types of ways. Weight loss, heart problems, cancer, kidney stones, just the health of your body, trying to get more into a proper pH, which is homeostasis, again, is the one of the most important things that we can do.
So what supplements are important for kidney stones?
Well, the two most important supplements are magnesium and vitamin B6. Those are just like the magic formulas to get kidney stones under control. But those are where you really need to start at. Surprisingly, calcium. So, most doctors sit there and say avoid any type of calcium supplements because of your calcium oxalate crystals, which is one of the most common ones. But it's interesting because if you go low on calcium, your body releases too much calcium into the bloodstream. And it actually shows up in the hair analysis when calcium goes too high in the hair. It means that you're low on calcium. And when calcium oxalate crystals start showing up in your kidneys, it's usually because you're too low in calcium, not too high, which is an interesting type of thing. So magnesium B6, calcium is very important. Potassium citrate, which medically they give too. It's just like a magic formula on dissolving kidney stones. The citrates are one of the most important things that you can do in taking supplementation. They're potassium citrate, sodium citrate, and the magic formula is magnesium citrate. Magnesium citrate is like the magic formula for most kidney stones. Inositol, which is also another B vitamin, vitamin K, vitamin D, vitamin A, the fat-soluble vitamins has a big role. And interestingly enough, vitamin D, if it goes too high, can cause kidney stones. If it goes too low, it can cause kidney stones.
There's that homeostasis.
Homeostasis. Fish oils and phosphorus are all different supplements that are critical for managing one's kidney stones.
Now, when we come back, we're going to talk about the diagnostics done for kidney stones so that you know the treatment and what treatment to go. We'll be right back. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Just recently had to go to the emergency room, though, and I had some stomach virus thing. I almost called an ambulance. It's weird, even considering calling an ambulance for yourself. You know? You call ambulances for other people, right? What are you supposed to say about yourself? Can you come get me? Yeah, I don't feel so good. Just come on in, I'll be lying on the floor.
The Voice of Health Wellness Tip featuring Jace Clinical Solutions, the most trusted CBD brand. Is CBD helpful for digestive issues?
That's one of the big areas that is probably underknown. Like if you have ulcerative colitis, Crohn's disease, IBS, IBD, any of those types of things, you can actually get that down through using CBD. It's probably one of the better medications that you can use to actually start to get some relief along those lines. It actually cuts down on not only just the sensation of pain in through the abdomen, it also helps with the actual function of the digestive tract. So what happens is your intestines go into spasm because of irritations, and which actually will make the whole problem worse. Whereas if you take the CBD, those smooth muscles will actually start to relax and start to function normally. For those with ulcerative colitis, they notice that the bleeding actually reduces. Crohn's disease, you actually see changes with the bowels. You start to get formed bowels instead of diarrhea. I mean, there's a lot of other things that we do, but that's something that really, really helps out with the symptoms and eventually as far as on the function and the overall health. So that's something that a lot of people don't know about, and that should be something that's actually used on a regular basis if those are problems that you have. And then the other thing that seems to be working is for urinary problems. Irritable bladder, where your bladder is irritated, but there's no infection. Seems to really help out too.
Go to thevoiceofhealthradio.com, click on the banner for Jace Clinical Solutions CBD products, and enter the code Prather, Prather, to receive a 25% discount on CBD products you can trust. Are you experiencing muscle pain or tightness anywhere on your body? Try the Rapid Release Therapy Cordless Pro 3. The Cordless Pro 3 is a targeted high-speed vibration therapy device used by medical professionals to quickly relieve a wide variety of aches and pains. After years of development, the Rapid Release Therapy Cordless Pro 3 is the latest in rapid release technology. It's more powerful, quieter, and lightweight with a long battery life, and best of all, it's cordless. Safe, effective, and easy to use, this This professional quality medical device has 5 built-in heads, giving you the versatility to treat small bony surfaces, such as fingers, wrists, and ankles, and powerful enough to quickly relax the tightest hips on professional athletes. Unlike the low-speed percussive devices, rapid release therapy delivers for sensitive areas like joints, neck, and ankles safely and comfortably, and provides the raw power your larger muscle groups need. Go to our website at thevoiceofhealthradio.com, click on the Rapid Release banner, and enter code PRATHER, P-R-A-T-H-E-R, for a $100 discount for the Voice of Health Radio listeners. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, where we get to the root cause of your health issue. Well, we're talking today about natural relief for kidney stones, and we're going to talk about the diagnostics involved. And we're using the word homeostasis a lot. And I always know when I'm in the office talking to patients that are radio listeners, they use that word homeostasis. So we're doing
something well. Right, yeah.
Oh, so why is hair analysis so important for kidney stone prevention?
Probably one of the most important things is the hair analysis, because it's basically minerals that kind of congregate into the kidneys that cause the whole problem. And so it's usually an imbalance on that. And also one of the most critical things is heavy metal toxicity. The two things that are like, the worst one is cadmium. So high cadmium, I had a gentleman who had gotten exposed to some high cadmium through cleaning his fireplace. He had a wood-burning fireplace, and you actually use cadmium mixture to actually clean it. And he decided he wasn't going to pay that much for someone to professionally do that, and decided he would do it himself. But it is a very toxic process and very, very dangerous process, because you can get like huge amounts of cadmium. And if you get cadmium toxicity, it destroys the lungs and the kidneys. And it is like one of the biggest things to form kidney stones. People who have high cadmium are just like guaranteed to have kidney stones. And they don't have just one a year. They have many every. And so that's one of the magic types of things, is finding that cadmium toxicity and getting it down. And that's one thing that medically they know, but they don't look for.
Well, next time, did he pay for someone else to do it?
Yeah, he said, I'm never going to do it. Matter of fact,
he paid for it, right?
Yeah, he actually had to go to the emergency room because of his lungs. So if you have a wood-burning fireplace, let a professional clean it. Do not do it yourself. Also, aluminum. Aluminum actually pulls out the minerals out of the bones, causes osteoporosis. It can cause hardening, arteriosclerosis. And it's the arteriosclerosis of the arteries that actually causes dementia. So that's why aluminum is known to be involved in those types of process. And then also, as it gets the calcium and the phosphorus out of the bones, it accumulates in the kidneys, and you get kidney stones. So those are two that are really big. And then also it shows up the balance between the calcium, magnesium, phosphorus, and all the other minerals. And as you balance that out, again, it's an accumulation of the materials in the kidneys because the body isn't balanced, and the hair analysis tells you how to balance out the minerals, which makes perfect sense.
So what herbals are helpful for kidney stones?
One of the amazing things is cranberry. Now, most cranberry juice is not really too much cranberry juice. It's mainly apple juice. And then it has high fructose corn syrup oftentimes in it, so there's a lot of stuff in there that you shouldn't have. Having real cranberry juice is something that you can do, or we give pellets with cranberry in it, which is very good. Black currant is actually even better. So black currant juice and plum juice is also really good. Something called Desmodium styracifalonium.
That's even a big word for you.
Yes, Desmodium, which is easy, but the styracifalonium is something else. It's a Vietnamese.
Does that have 10 syllables?
Yes, it's a Vietnamese herb that we actually have in one of our supplements that is like the magic kidney stone dissolver. So that is absolutely a great little herb to get kidney stones down. It does a whole bunch of other things for the kidneys, the heart, all sorts of different benefits along those lines, but that is an absolute wonderful herb. Rose hips are very good. They seem to be the best form of vitamin C to get kidney stones down. Parsley juice, again, very alkalizing. Lemon juice has citric acid in it. So one of the things that we had a lot of patients do is they take one fresh squeezed lemon in pure water and then drink it down along with some magnesium citrate. We had a gentleman who just was almost, he actually had tried to commit suicide because of the kidney stones, because it was so constant. And I did not actually ever see the gentleman, but I talked to him over the phone. Because he sat there and said, I need to know what to do. And I said, well, come out here. And he says, well, I can't right now. And I said, okay, take a lemon, squeeze it into water, and then take some magnesium citrate, about this much, on a daily basis. He started to do that, and we eventually called him back up to see how he was doing. And he says, I'm good. Last time I heard, it was like 5 years, and he hadn't had a kidney stone attack. And that's all he did.
Wow.
And so, again, there are things that can be done, but the lemon juice with the citric acid in it seems to work really well.
So why is blood work critical for treating kidney stones?
Well, that's one of the ways that we know what's going on. There's different blood tests that we can do. We need to know how much damage has occurred to the kidneys. Is there any endocrine problem that's occurring? The adrenals being off, the thyroid, parathyroid, are any of those types of things occurring? If we know that, then we know how to get the homeostasis back under control and see what's going on. Also, the blood minerals are critical along those lines.
And then we talked about the so important hydration.
Hydration, yes.
Yes. Why is hydration so important for kidney stones and preventing them?
If you are properly hydrated, and what you're looking for is at least 50% of your body weight water. Ideally, when you're born with 60%, and 60% is the ideal. And 50% of all kidney stones wouldn't occur if you were hydrated. And when we get people in and we do something called a body composition analysis, we always look for hydration, and 50% of the population is dehydrated.
Is it harder to hydrate as you get older?
It is. It is. You need to drink more water usually. But that is one thing that we test on everyone, is just your body composition analysis and see what's your hydration. And we actually do that for free. And so that's one thing that we always tell people: you're dehydrated. Don't do that. And people go, okay.
Yeah. I mean, you're seeing more and more people with big water bottles, you know, and just carrying them with wherever they go.
Right.
And you want to make sure it's good water.
And getting really hydrated goes a long ways in dissolving them. And one of the most important things in passing a kidney stone is getting really good hydration. And one of the things that I really recommend is Fiji water to get that up, because it has silica in there, which really helps. And that also helps out with the kidney stones. Yeah,
and we have the IV therapy we're doing now.
Hydration.
For hydration.
Yes.
I'm actually going to get that this week.
Yeah. And if you get hydrated and you're starting a kidney stone, getting an IV of that really makes a huge difference.
So what drinks are bad for kidney stones? I don't know if I want to hear this.
Well, interestingly enough, coffee. Now, 1 cup a day actually cuts down on kidney stones.
Okay.
More than that, it actually causes kidney stones, which is interesting. Kind of weird. But decaffeinated always causes kidney stones. Decaffeinated is one of the bad things.
I don't understand why you drink coffee decaffeinated. What's the purpose of coffee?
That's the whole reason that you're trying to drink it, right? Is get that caffeine. What's the purpose?
What's the purpose?
Tea. Again, we talked about the sweet tea down in the South, just like kidney stone type thing. Colas, especially dark, and then they have high fructose corn syrup. Artificial fruit punch type of things are horrible. Energy drinks, Gatorade, those types of products. The phosphoric acid that makes kind of the bubbles is also a big thing that kicks off kidney stones, beer, wine, and orange juice. Now, lemons take down kidney stones. Orange juice actually increases kidney stones.
Interesting.
Isn't that interesting?
Yeah, an interesting list there.
Yeah.
Huh. Okay, well, when we come back, we're going to talk about more on the natural treatments for kidney stones. We'll be right back. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip featuring Natrum Naturals, goodness in a gumdrop. Today we're here to talk with Kira. She is one of the founders of Natrum Naturals to talk about their best-selling Mushroom Elixir gummy supplement. This gummy contains 10 strains of medicinal mushrooms like reishi, chaga, and turkey tail that boost immune and brain function, help regulate energy levels, and increase overall vitality. So I've heard a lot about reishi. Can you tell us a little bit more about this specific mushroom in the Mushroom Elixir and its benefits?
Yeah, reishi is one of the most studied medicinal mushrooms, and it's really popular in Chinese medicine. It's used to strengthen the qi, or the life force energy, and it's also known as an adaptogen. So it promotes balance within the HPA axis, which is that hypothalamus, pituitary gland, and adrenal glands axis. And this allows the body to regulate stress better and really just improve overall stress resiliency. It's also a wonderful regulating mushroom, kind of how we talked about with the energy, how, if you need more of a boost, it can help with that. If you need more of a calming sensation, it can help with that. But it does the same thing with blood pressure. So it can reduce blood pressure in the case of hypertension, but it can actually increase blood pressure with someone who has hypotension. So it's got these really incredible regulating properties.
So why did you choose to make this into a gummy?
The more research that's come out lately has been showing that extracts of mushrooms are actually absorbed a lot better by the body. So there's a lot of these powdered mushrooms, mushroom tea, mushroom coffee, which you get some of the beneficial constituents from, but when it comes to getting the most medicinal constituents, you really have to make an extract. So gummies are the best way to get that extract in, but to also make mushrooms taste good, because that does definitely put people off a little bit. But
they do taste good.
They do taste really good. So that was another reason. And just helping out with patient compliance, people are more willing to take a gummy, something that's kind of fun and engaging and tastes good, but also is highly medicinal and beneficial for the body.
Yeah, and there's some people that don't like mushrooms, where the gummies, they taste good, eating gummies.
It's kind of like a raspberry flavor. So it really hides the mushroom taste. And if you're used to like normal, those white mushrooms that we see most commonly here, these mushrooms don't even have that same taste. So it's very different. It is a little earthy, but earthy and like fruity at the same time.
Yes, exactly. That's what they taste like.
Yeah.
You can find the gummies at natrumnaturals.com and use the exclusive code Voice of Health, no spaces, Voice of Health, for 20% off orders of $75 or more. Natrum Naturals from Holistic Integration, goodness in a gumdrop. Since 1893, the Wheeler Mission has been ministering to the homeless, poor, and needy in central Indiana. This month alone, they are planning to provide almost 27,000 meals. Their monthly shopping list includes 100 turkeys, 100 hams, 600 cans of green beans, corn, and sweet potatoes, 100 cans of coffee, and 100 pounds of sugar, and lots of individual cookies, bags of potato chips, bottles of water, as well as napkins and disposable cutlery. The Wheeler Mission Pantry empties fast these days, and they could use your help restocking their shelves. You can help by bringing canned goods and non-perishable food to the Wheeler Mission, or you can make a gift today on their website at wheelermission.org. Your gift not only helps with their shopping list, but fills the lives of hurting men and women with new hope through food, shelter, care, and God's love. Learn more about the work of the Wheeler Mission and how you can help by visiting their website at wheelermission.org.
Don't stop believing. Hold on to that feeling, yeah. Street lights.
You're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, where our mission is restoring hope to our patients. Well, we're talking today about the natural relief for kidney stones. And very interesting, even from the start, how many different kidney stones there are.
Yeah.
And we're talking about the more structural functional approach to kidney stones and prevention. One thing you talked about is apple cider vinegar. Why is apple cider vinegar one of the best things for kidney stones?
One, it prevents it. Also, if you are going through a kidney stone attack, that's a really great thing to do. Basically, if you have small kidney stones, usually you can take apple cider vinegar on a daily basis, and in 4 weeks you can get rid of them. Now, some of the larger ones, it can take a year. But apple cider vinegar, taken over a period of time, will completely dissolve kidney stones in the kidneys. So it's one of the best medicines that you can possibly take. One, it's high in acetic acid, which is one of the things that you're looking for to get that down. And then also it's a very alkalizing product. That and actually persimmons are extremely alkalizing.
Yeah, you
And
love persimmons.
We're kind of in persimmon country, and that's a great alkalizing food. So one of the healthy things to do is to take that, and then apple cider vinegar is one of your best medicines that you can take.
We found it in gummies.
Yeah, and then and they actually don't taste too bad, which is a great way to do it. Yeah.
Can stress cause kidney stones? I think I know the answer to that one.
Yeah, stress causes everything. But yes, stress throws off the homeostasis of the body. Throws off the endocrine system. It just does all sorts of things. So high stress is one of the things that can lead to kidney stones. So reducing your stress levels is important.
What are the symptoms of kidney stones?
Well, the symptoms of kidney stones is back pain. And when they start to pass, it's severe back pain. Actually, will go down into the groin and work its way up. Blood in the urine is another thing that shows up. Whenever we do a urinalysis on somebody and there's blood in the urine, then we think of kidney stones. Nausea. People get very nauseated when that starts to go through. A lot of it has to do with the high levels of pain, nausea, and vomiting. Sounds like a lot of fun. Yay. Fever and chills. And then, interestingly, one of the things that's fascinating is I've had several patients come in and said, Doc, this seems kind of odd thing to ask, but my urine smells bad. And it's a little cloudy, or it's cloudy and something like that. And I go, let's check for kidney stones. No pain, no other symptoms. And what it was is it was starting to release because it had kind of broken up. But it can be a precursor to that actually starting to occur.
So it's cloudy urine.
Yeah, cloudy urine, or urine smells different than it should, and you didn't just eat asparagus.
Yeah.
And that has been a warning sign for several people.
So should you go to the ER when you have a kidney stone attack?
There are definite times to go in there, because if you're having just excruciating pain, a lot of blood in the urine, nausea, you got something too big to pass. And if you don't go in, you can have some permanent damage that can occur. And so there are definite times that, they've called me up and said, you got a kidney stone attack, tell me all your symptoms. And I go, go to the ER, because this is something that needs medication right away. This is going to require, some treatments to get that probably broken up. So get there and get there now.
Yeah. So what can you do at home for a kidney stone attack?
Well, you start, drinking lots of fluid. Getting some citric acid, if you have some potassium citrate there. Magnesium citrate even works better on trying to break that down, but just really getting the fluid in there. Trying to get your urine alkaline instead of acidic. And then try to get different types of products in there that can help to break it down, just to kind of ease it up as it's going through. So there are a lot of things that you can do at home. So being prepared along those lines, again, I like the Fiji water, really get that down. That seems to get the hydration up quickly. And oftentimes you can make it through if you are right on top of it and going after it.
Yeah, paying attention.
Paying attention and have those things there.
And if you have the low back pain, checking, having your kidneys checked. You, as a chiropractor, you can palpate the kidneys and
I know exactly if it's the kidneys or the back. It doesn't take me any time at all to know the difference.
Mm-hmm. Right. And if someone is getting treated for low back pain and it's not getting better, definitely
have that checked, yes.
Yeah, kidneys. So can structure function care help with kidney stone pain during an attack?
Yes. Some of the things that people have come in that have found some really amazing relief is acupuncture. Mm-hmm. Also some auricular therapy, which helps out with the pain tremendously. And then, of course, all the natural different types of products, really getting that into the system. Also, an IV hydration bag can oftentimes relieve the symptoms because you're getting a lot of fluids into the system. Mm-hmm. And as you get that down, that's one of the main things that the medications are there for. Then also getting on some products for anti-inflammatories, but the acupuncture and auricular does amazing on how that can take that down. I've had people, they were in severe pain. I stuck a needle into kidney 3, and it was amazing at how quickly the pain went down. Mm-hmm. Tolerable.
So Dr. Prather, you said acupuncture can help. Talk about that a little bit and about auricular therapy care that we do.
One of the common questions, because I do, and oftentimes I do a combination of acupuncture and auricular on people. Mm-hmm. The acupuncture works more on the body. Auricular works on the brain. So like addiction and chronic pains that kind of hit. So people who have kidney stones on a regular basis and you have pain that's associated with that, each time that you have the kidney stone attack, the pain seems to get higher. Not better, worse. Uh-huh. So it's like, well, my first one I thought was excruciating, but my second one was even worse. And my third one was, I didn't care what I needed to do to get out of the pain, but I was going to get out of the pain. Mm-hmm. And the brain starts to make pathways for pain. And so the more times that you have a certain kind of pain, the more the pathways get higher sensitivity. Mm-hmm. So the more times you have kidney stone attacks, the worse the pain. And auricular really helps that out because it changes the brainwave patterns. So brain pain is actually helped quite a bit by the auricular, whereas the acupuncture works on the actual inflammatory process itself. So almost any type of inflammation in the body can be taken down, and the pain that's associated with that, with acupuncture, if you know which points to hit. So oftentimes we can have a lot of pain, and most people after an acupuncture treatment are pretty much out of pain. So nice. A combination of the auricular and acupuncture is a great way to help with kidney stone pain.
So you've been talking about soda's not good, but I have a question. What is the story of Coca-Cola and kidney stones?
Well, Coca-Cola used to be a different product. Mm-hmm. Now they have the same basic herbals types of things, but of course it was sugar, which isn't as bad for the kidney stones instead of the high fructose corn syrup. Mm-hmm. But Coca-Cola, according to what I've heard, now Coca-Cola itself actually says no to this, that didn't happen. But Coca-Cola was originally designed for kidney stones. That's why they had cocaine in there for the pain of the kidney stones. And they had an herbal formula that helped with that. So they used sugar, soda water to help with the fizz. And then Coca-Cola at that time was green. You know how they had green Coca-Cola bottles? Well, it was actually green in there too. So nowadays Coca-Cola isn't the same because they use high fructose corn syrup and they put coloring in there, which doesn't help. But Coca-Cola is one of the things that people have actually found helps to dissolve kidney stones. Also, like you have battery.
Yeah.
And you accumulate, you pour Coca-Cola. Only Coca-Cola works, but it dissolves it. And there's actually an herbal formula in the Coca-Cola that was designed for kidney stones. So that's the story of Coca-Cola.
So sometimes do you recommend people?
Well, yeah, if you can find like Mexican Coca-Cola in the bottle, they don't use high fructose corn syrup, but actually use real sugar. And that actually seems to work pretty well.
Interesting fact.
Interesting fact.
Well, thank you, Dr. Prather.
Thank you.
Holistic Integration is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.